Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hi, I'm Susan Kaufman, and you're listening to Attitude Magazine's ADHD Experts audio broadcast today. And the topic is adult ADHD. How's it diagnosed? Why do so many adults seem to wait until way later in life to get a diagnosis? Why is it difficult to diagnose, and how are symptoms different in adults than in children? I am so pleased to welcome back today Dr. Bill Dodson. He's a board-certified adult psychiatrist, specialized for almost 30 years in adult attention deficit disorder. He is currently in private practice in Denver, Colorado, where he's a life fellow of the American Psychiatric Association. He is the author of the forthcoming book. We are waiting anxiously for it, What You Wish Your Doctor Knew About ADHD. For more information about Dr. Dodson, please visit his website. It's dodsonadhdcenter.com, www.dodsonadhdcenter.com. Dr. Dodson, thank you so much for joining us.
Thank you, Susan. Adult ADHD really is fairly old. It was originally and officially acknowledged that ADHD lasted into adulthood in 1980. So it's been 34 years. Unfortunately, we still don't have separate diagnostic criteria for adults with ADHD. Since the latest update of the diagnostic criteria just 2 years ago, pretty much neglected doing anything with ADHD. They made a few cosmetic changes. That means that it's going to be another 13 years before this is corrected. Thus far, just about all of the ADHD research has been done on a subset of people who are highly symptomatic, very high levels of impairments. People who slugged through, who did well, who weren't hyperactive and called attention to themselves, didn't get included in studies. So we've only been studying a very small sliver of all the people who have ADHD. For an adult to meet the childhood criteria, they would have to be behaving like an elementary school-age child with untreated ADHD. An adult who's behaving at that level is very severely impaired. One of the reasons why this has become the case is that up until now, they've been trying to show the continuity between the childhood condition and the adult condition and show that they were actually the same thing. That's already been done, so it really serves no purpose to continue doing that. The average age at which an adult gets diagnosed with ADHD is 36. In other words, all of these people have been through and completed their formal education. They've started a career, gotten married, had kids, before they finally figured out that they had ADHD. And that usually happens because of a success. People get promoted, they have a child, and they just can't cope any further. People with ADHD nervous systems are usually much brighter, average IQ in the 120s, much more creative than the average neurotypical person, and over time they find lots of compensations to make their way through school and life. The current diagnostic criteria do not pick up these people who are bright, hardworking, problem-solving, who have found clever ways around their difficulty, have learned to hyper-focus on cue, and who did not exhibit impairment prior to the age of 12. And there are a number of reasons for that. There's a number of reasons that ADHD isn't recognized. In fact, it doesn't even come on the radar screen. And the first thing is that ADHD nervous systems are consistently inconsistent. People with ADHD don't always have impairments. In fact, if you ask most people with ADHD, if you've been able to engage with any particular task of your life, have you ever found anything you couldn't do? People with ADHD know that that's the problem. They can't engage on demand. As Russ Barkley is well known for saying, ADHD is not a problem of knowing what to do, it's a problem of doing what you know. Physicians are not going to recognize ADHD. Every 10 years, they do the National Comorbidity Survey replication, where they interviewed 10,000 adults, and they're trying to figure out what the prevalence is of any psychiatric condition. For the first time, ADHD was included in this study, and what they found was that 8.4% of adults met diagnostic criteria. And they were seeking treatment. 43% had been in mental health treatment in the previous 12 months. But only 1 in 10 of the people with ADHD had ever received treatment during that year. So they were symptomatic, seeking help, and the diagnosis was never even considered. This is why 95% of people who do end up with a diagnosis of ADHD are self-diagnosed. They figure it out on their own. One of the most common presenting complaints, very few of them actually point toward either attentional problems or impulsivity or hyperarousal. By far, the most common complaint is mood lability. 43% of people list that as their major problem. 18% will say anxiety is, and usually they're using that word incorrectly. They're using that word to describe their hyperactivity. But there's also relationship disappointment and rejection-sensitive dysphoria. 40% of people list this as their major impairment from ADHD. Another 40% list insomnia and sleep deprivation. Interesting enough, these two features that make up more than 80% of adults have never been diagnostic criteria. They're not even considered. There's also low self-esteem that comes from unmet potential and poor job and relationship performance. And many people end up trying to self-medicate their hyperactivity with alcohol and marijuana. As you can tell, it's going to take a long time to sit down and go through someone's entire life. And unfortunately, insurance companies only want to pay for a 15-minute doctor's visit. That can't be done. People also still think in terms that you have to be hyperactive or disruptive to have ADHD. In point of fact, only about 25% of people are ever overtly hyperactive. The noisy ADHD, the disruptive and obnoxious little boy in the first grade, gets recognized and treated, but the majority of adults are silent and therefore do not get recognized. ADHD is almost completely genetic in origin, and as a consequence, you're going to find it running in families. If one parent has an ADHD nervous system, half of the children and half of his or her brothers and sisters will also have ADHD. ADHD is picked up across the lifespan at different times. At first, it's the hyperactive kid that nobody can miss. He's disruptive, obnoxious, can't sit down in first grade. Then the next time people get recognized, it's the very high potential child who's having trouble with any sort of learning to read and learning mathematics and stuff like that because they can't pay attention. And usually the ADHD is picked up as a secondary finding when they're being screened for learning disabilities. The next time you see a big burst of people being diagnosed is when they go off to middle school, and all of a sudden the complexity of organization overwhelms them. They have to have a different book and different homework in a different room, and they just can't organize themselves. The next time you see it is when somebody goes off to college or goes out on their own, and they have not internalized all of the structures and routines that they need to, and they crash and burn. And then for adults, it's usually when they get a promotion, something good happens, and they just can't do it anymore. They've just run out of steam. Adults with ADHD are going to run into many other obstacles to getting competent care. One of the biggest ones is shame. People with ADHD have struggled and failed their entire life. They've been told over and over again that they haven't met other people's expectations and have been disappointments. And let's face it, anybody, especially in elementary and high school, who's told they have ADHD, that kid's going to hear it strictly in terms of, you've got bad brains. Many adults come into treatment after what we call an exit interview. Someone else in a relationship or the boss says, you've got to do something about your ADHD or you're not going to be around much longer. Unfortunately, these people are what we call having been brought in rather than having bought in. Usually they have no motivation for treatment, and as soon as the heat's off, they sort of wander away. The other big problem is you're going to find that almost a majority of physicians do not even believe that ADHD exists. It's very hard to find a competent clinician. A survey from the Mayo Clinic 4 years ago found that the average family went through 11 clinicians before they could find one they thought was competent to treat their child. The best way to find a competent clinician is to start either with the Attitude website, which has a number of good referrals, or go to a CHAD meeting or an NADDA meeting. These are people who are just a couple of years ahead of you, and they can tell you who's good and who's not. Once you do get into treatment, the treatments that work are very much the same. The stimulant medications are the treatment of choice, not the treatment of last resort. The medications are the same for adults as they are for kids. The dosage ranges are the same, the duration of action, the potential side effects, and the extremely high level of safety of these medications is the same regardless of what your age is. The traditional therapies that have been offered, behavior modification, insight-oriented psychotherapy, cognitive behavioral treatments, all of these things have not been found to change the basic features of ADHD at any age. So right now, medication is the way to go. These treatments are situation-specific. You can see some benefits while you're right there with the therapist, but quite literally, you can walk out the door and out of that structure, and all the benefits disappear. Lastly, treatment's a family affair. Half of the family will have ADHD, and half of the family will be neurotypical. And each one needs to understand that they're wired differently from the others in the family. So education of the entire family is essential about what ADHD is, its strengths, its weaknesses, and its treatments. Thanks very much for listening.
Dr. Dodson, thanks so much. That was a great introduction. We have lots of questions. Let's just stick to diagnosis for a minute here. One of the people on the webinar said, and this sounds, I think, pretty consistent with what you said, she was diagnosed at age 64 after lifelong unsuccessful treatment for depression. Do you frequently see that depression, anxiety, and other mental disorders are confused with ADHD?
Virtually always.
Wow, always.
American physicians are going to only recognize what they've been trained to think of and recognize, and that's going to be either anxiety or depression. 93% of adult psychiatry training programs do not mention ADHD in 4 years of training. Amazingly, 20% of pediatric programs never mention ADHD. So you're going to have people who are going to recognize, especially the mood lability, the dissatisfaction, the demoralization of ADHD as depression, and they're going to recognize the hyperarousal and rejection sensitivity as anxiety. They are not going to think of ADHD. Consequently, if you don't mention it, if you don't figure it out, it probably won't be detected.
It's really fascinating because there are a number of people on the webinar who have posted that, almost guiltily, I think I have ADHD or I've diagnosed myself with ADHD. But what you're saying is that's very common for people to figure it out themselves.
That is 95% of the patients I see.
Wow.
The way I view it is every doctor you've ever seen has failed you. Every teacher you've ever had has failed you. You figured it out on your own. You're coming in to get appropriate treatment. That's to be praised. It's a wonderful thing because the medications and treatment almost always are life-changing, dramatically effective. But again, it's one of those things where you have to do it yourself. Unfortunately, a lot of docs are a bit skittish when somebody comes in telling them a diagnosis that has a treatment with controlled substances. So they're always afraid of being scammed. So be prepared to be treated initially with some suspicion. That's why it's so important to find somebody who really wants to be treating ADHD, and that is probably not your current primary care physician.
Right.
Take the time to find somebody.
Okay. I'm wondering, we have some screeners on our website and they're available elsewhere. Is it helpful to take a screener and print out the results and take it into the doctor, or will they see that as even more suspicious behavior?
Most of them will view it as more as suspicious behavior. Again,
Really?
remember that 43% of physicians are, back in the Stone Age, or troglodytes. They aren't even in the game. ADHD doesn't exist. So you're almost at a 50-50 chance of running into somebody like that.
Okay, so it's really critical to find the right physician, and I guess, from the beginning, right? And I guess to be persistent. One of our Michelle Novotny, who did a recent webinar, that was her basic message to women: be persistent, get help.
Yes.
So I think it's pretty easy to be shamed into just sort of not getting help.
Right.
Yeah. So there are some people on the webinar who believe or have been diagnosed as inattentive ADHD, and they seem to feel specifically, even more than others, that it's hard to get treatment. And a couple of them have said that medication hasn't helped them. Can you comment on inattentive ADD specifically and how it's different from others and what the diagnosis and treatment issues are with it?
The whole construct of inattentive versus hyperactive impulsive versus combined turns out to be a dead end. All the research has shown that it predicts nothing. It doesn't predict response to medication, doesn't predict the course of treatment, course of life. It doesn't predict anything. It was just an idea that somebody had, and it turned out not to go anywhere.
Wow.
If you talk to people who are not overtly hyperactive, they're still pretty hyper-aroused.
Mm-hmm.
If you ask them, how many thoughts do you have going on in your head right now, you'll get this sort of wry smile, and they go, 4 or 5. Again, all the hyperactivity is turned inward, so that they are going 90 miles an hour, but you couldn't tell it from the outside.
Wow.
So everybody is still the combined type. It's just not overt. And again, that was the real problem with the childhood criteria, is that they really don't describe ADHD that well, but they're things that you could see and count. And so that's why they were put in there. The criteria were done for researchers, not for clinicians.
Right. Lori is saying that she has a PCP who has ADD. He gets it, and she's been on medications for 3 years, and it's changed her life. So there you have it. I guess you need to find a physician with ADHD.
Well, again, that's the rule. What's going to get a physician to spend 2,000 hours trying to dig it out on his own or her own usually is that the clinician has ADHD themselves or has a family member with ADHD who got terrible treatment, and that's their motivation for putting in all that work.
Right. That's really interesting. Yeah. The numerous people on the webinar who have been being treated for anxiety and depression over the years are asking a couple of questions about treating what could be, both conditions at the same time. How they're concerned that treating ADHD, they've been told that it's bad for anxiety. That's one issue. And then another issue is many of them are taking SSRIs and are wondering if that's a problem with either treating ADHD or getting off SSRIs. I guess they're wondering about the interaction with SSRIs and treatment of ADHD.
With anxiety in particular, the first thing I ask a patient is, tell me more about your baseless, apprehensive fear. That's the definition of anxiety. That somebody feels that something awful is just about to happen. People with ADHD will say, I never said I was afraid. So what I'm describing as anxiety is I'm constantly revved up. I can't slow down. I can't watch a TV program with the family. I can't turn off my worry to go to sleep at night. In other words, what they end up describing is the hyperarousal of the ADHD nervous system. And they put the only label they have on it, which is anxiety. Now, people with ADHD, again, very commonly have another diagnosis, and it's not uncommon to have people with both ADHD and an anxiety disorder. The 5 studies that have been done on the stimulant treatment of people with both have found that the stimulants do not make anxiety worse. That it just everybody expected to. 5 out of 5 studies did not find that. Go ahead and give it a try. Again,
Okay.
with ADHD medications, you're going to see what that medication is going to do in 1 hour. This is not a tremendous commitment. It's just committing yourself to 1 dose of medication and see what happens.
If you take ADHD medications and you have a good result, does that confirm the attention deficit disorder? That's a question from several people, including Kristen.
Yes. And again, what we're looking for with the medications, the stimulant medications, is a wow, life-changing level of change. There is this false belief that anybody who took a stimulant would do better. There's actually no research to show that that's true. There's no evidence to show that that's true, and certainly not a wow, life-changing level of performance and mood stability and things like that. Non-response does not mean that you don't have ADHD. If you took 100 people with ADHD and you tried them on the 2 standard molecules, methylphenidate and amphetamine, 88% are going to have that wow, home run level of response. But that means that 12%, 1 in every 8 people, tries both molecules and sees nothing or only sees side effects. So if you don't have response, that doesn't mean you don't have ADHD, and it doesn't mean that another medication wouldn't be helpful.
Okay. Are there any conditions under which it's not safe, high blood pressure or whatever, to take stimulant medications? And in that case, do you recommend non-stimulants?
If you look at the things that stimulants would make worse, it's going to be things like arrhythmias, high blood pressure, history of a heart attack, glaucoma, thyroid disease, seizures, a whole list of them. The point is that once those conditions are stabilized and well treated, you can take the stimulant medications and do well. Again, these things are contraindications only if they're not treated.
Got it.
Once you've gotten good treatment, you can, about the only thing that's going to keep you from doing it is if you're allergic to the medications.
Right.
But again, this is why you want somebody with a lot of experience, too.
Okay, yeah, because here we have someone whose physician took her off medication because it appeared to increase her blood pressure, but didn't give her any other options. So really what you're saying is treat the blood pressure and then try medications.
Well, actually, blood pressure, if it does go up, just means that the dose is 1 dosage strength too high.
Okay.
There are lots and lots of studies that show that if you're on the right molecule at the right dose, these medications have no effect on cardiovascular functioning. So, in fact, in my practice, I take everybody's blood pressure every time they come in because the medication, if it's right, doesn't change the blood pressure or pulse rate at all. So all it really meant was she was 1 dosage strength too high. Lower the dose.
Got it. Okay. Here's someone who says he has clients, I guess, who's been prescribed stimulants to treat ADHD, but then in turn the psychiatrist won't continue prescribing the benzodiazepines that for anxiety that they prescribed in the past. What's your feeling about treating both ADHD and anxiety simultaneously?
That's the nature of what we call comorbid or coexisting conditions. They are 2 separate conditions. Each one makes the other worse, but they are separate diagnosis, separate treatments. So you treat the ADHD and you treat the anxiety disorder just the way you would if they were the only disorder there. So I go right ahead and treat the anxiety disorder the way I would for anybody.
Oh, here, I love this from Marianne. She says she's taking an antidepressant like Effexor, but then she's drinking caffeine and exercising. Is that a good response for treating ADHD? It seems to be working for her.
Well, if it's working, that's okay. There are two studies that Effexor has a very minor benefit for ADHD, detectable, but not anything to write home about. A lot of people will use what's available to them to treat their ADHD. About 20% of people can get a very good result with aerobic exercise. It's called the Michael Phelps phenomenon. And the trade-off is about 4 hours of really good functioning for every hour of aerobic exercise. A lot of people will use caffeine. It's not, again, not great, but it's better than nothing. About twice a year, I'll have somebody come in who's drinking 2 to 3 pots of coffee a day.
Wow.
So all of these have detectable benefits, but nothing like the wow level of benefits that you get from the standard medications.
Can you talk about titrating medication? Because there are a couple of people here who say they tried medication, but it didn't seem to do anything, so they stopped. Is there a standard method by which you really find out whether you get the wow effect? Or,
Sure. Start with the notion that the dosage strengths that are made only cover about 50% of people. About 8% of people are going to get their optimal results at doses lower than the lowest dose made, and about 40% of people are going to get their optimal results at doses higher than the highest dose made. So if a doc stays within the strengths that are available of any of these medications, they're going to undertreat or overtreat 50% of people. For those who are just not seeing anything, no benefits, no side effects, the first thing I do is I tell them, take it on an empty stomach, no citric acid or vitamin C, because citric acid and vitamin C will prevent the absorption of every formulation except Vyvanse and the skin patch Daytrana. So remove citric acid and vitamin C, see what happens. If they're still not seeing anything and you've raised the dose up, fairly high within the dosage ranges that are available, then you need to go see an expert, because you're in that 12% of people who need other approaches. And there are other medications, the alpha agonists, that sort of thing. But about 88% of people are going to get that very robust response to one or the other of amphetamine or methylphenidate. One of the most common things I see is somebody comes in and they've tried 4 different formulations of methylphenidate, but they've never tried amphetamine or the reverse. Always try both molecules.
okay, yeah, because different people respond to different.
That's right.
Right, okay.
Everybody will have a preference for one molecule over the other, but nothing predicts that in advance.
Just a last comment on diagnosis, a post that I just think was pretty amazing. She says, after years of struggling with my son's ADHD, I was diagnosed as, quote, 51% likely to have ADHD into 10 of type. She says, why aren't the diagnoses more definite? It sounds like she needs to see someone else. Would that be the answer?
Yeah.
51% likely.
It's amazingly, a lot of adults still fit the childhood criteria. I have a webinar back a year ago that goes into the newer ways of diagnosing ADHD, where you can say always and never. And just real quickly, what that is that people with ADHD get engaged. ADHD is a problem of getting engaged and staying engaged in a different way. They can do it when they're interested, challenged, find it novel or urgent, but they've never been able to make use of the 3 ways of engaging that neurotypicals use: importance, rewards, consequences. So a person with ADHD can look back over their lives and say, not once have I ever had importance help me in the slightest. The very things that organize and motivate everybody else I know, for me, importance, rewards, and consequences are nothing but a nag. I can only get access to my abilities and get stuff done when it's interesting, challenging, novel, or urgent. And that's something where you can say always and never. Be 100% sure.
Interesting. Okay, let's go to some symptoms here. There's a very moving email from Caroline who says, I think I have ADHD by reading about it and helping my son who has ADHD, but I haven't been diagnosed. However, she's developed an extreme sleeping disorder in addition to her struggles with grocery shopping, planning, organization. And so she works as a teacher grading and papers, and she feels that she's never done. So she falls asleep at her desk, wakes up in a panic, works all night, sets the alarm, wakes up, and she can't seem to break the habit. Her question, I guess, is this kind of sleep issue common for people with ADHD?
One of the things I said in the presentation is that one of the most common presentations and impairments is insomnia.
Right.
And 40% of adults say that's their biggest impairment. Again, but it's usually not recognized as being part of ADHD. 90% of adults will give the following history. They'll say, Doc, I'm a night owl. I've always been a night owl. When the sun goes down and everybody else is getting quiet and ready to go to bed, I get a burst of energy. And it's usually the best time of the day for me. My mood's best, my productivity's best, and I know that if I got into bed, I'm not going to be able to turn my brain and body off for a couple of hours. Toss, turn, fidget, my thoughts bounce from one concern and worry to another. There's another small group of about 20% where they fall asleep easily, but then they wake up an hour or two later and they're up for 2 or 3 hours with their brain just bouncing around. And then when they try and wake up in the morning, they're in the sleep of the dead. That's the hyperactive component of ADHD, and for the majority of women, that's the only time you see overtly the hyperactive component of ADHD. It's not there consistently 24 hours a day. It hits you when the sun goes down.
Wow. Yeah, Joanne chimes in. I did way better at night school. She says, yeah. So, wow, that's interesting.
And the treatment is not a bunch of sedative, hypnotic sleep aids. It's treat the cause, and that's ADHD. So what I ask my patients to do is once they've found their best medication and dose, simply lie down in the afternoon and take a nap. Prove to yourself that you sleep great once your ADHD is treated. At that point, they can take medication 24 hours a day, 7 days a week, and sleep normally. Sounds utterly wacky, totally counterintuitive, but it's what works.
Right.
And
Interesting.
And you can prove it with that no-risk trial nap.
Yes, absolutely, yeah. What's the prognosis for children with severe ADHD? Bev has a son, and she's wondering how do symptoms change as kids become adults, kids who have pretty severe ADHD?
What gets kids identified usually early is their behavior. It's strictly, in fact, to this day, ADHD is listed in a category called disruptive behavior disorders, which again, those are the kids that we pick up, and that's why we persist with this notion that you have to be hyperactive to the point of being disruptive, when actually the vast majority of people never are. As kids get older and they hit age 13 or 14, that hyperactivity dims down significantly. That's what made people think ADHD went away in adolescence, when really it just, they weren't obnoxious any longer. What happens then is that's when you see the sleep disturbance. The hyperarousal dims during the day, but it shifts to nighttime and presents as insomnia.
Wow, okay.
Then as you go on, again, after that, it's ADHD is going to be presenting as impairments of functioning, impairments of success. To Hallowell and Rady, for instance, in their groundbreaking book, Driven to Distraction, for them, the definition was a person who comes in and says, I have never come anywhere close to fulfilling my potential. That's ADHD until proven otherwise.
Yeah. Carol says that older women are told their sleep issues are from menopause. She's wondering how you distinguish that from ADHD-induced insomnia.
Again, ADHD is a lifelong condition. You can find these symptoms. In fact, you have to find them going all the way back into childhood. All these symptoms have to be rooted in childhood. They will get worse with menopause. And usually this is in women who already had significant premenstrual syndrome. Women with ADHD get PMS, the technical term is PMDD, premenstrual dysphoric disorder, much more frequently, much more severely than the general population. And during that 3 to 7 days before menses, their ADHD medications just don't work at all. And so when women go through menopause, their estrogen level goes to 0, the ADHD gets much worse. Again, if the sleep disturbances have always been there and they just got intolerable when you went through the change of life, probably ADHD, and that's one of those, I think, heroic indications for hormone replacement therapy. Gives a person their life back.
Yes, yeah, absolutely. Question about different types of ADHD. You know, Dr. Amen makes the case that there are very different types of ADHD. I guess as part of that question, you know, some people with ADHD have extreme irritability and self-sabotage and oppositional behavior. Is this a different type of ADHD? How would you characterize the different kinds of ADHD or the different types of symptoms?
Yeah. Dr. Amen's approach is shared by no one but Dr. Amen. His 6 different types are nothing more than ADHD plus a common coexisting condition. His ring of fire ADHD is nothing more than ADHD plus bipolar, that sort of stuff.
Okay.
So he's got his own way of packaging it. So really what we're looking at there is ADHD plus.
Plus X or Y.
ADHD,
right.
Yeah. ADHD plus depression, ADHD plus alcoholism, that sort of thing.
Okay. What about irritability, rage, those symptoms? There are several people on the webinar who are either living with people or experiencing that extreme irritability and rage. How do you approach that?
One of the other things that I personally think, and what I've found in my patients, is one of those places where you can say always and never, is that thus far 100% of my patients have had what's called rejection-sensitive dysphoria. And what that means is that people with ADHD are hardwired from birth, neurologically, that if they perceive that someone else has withdrawn their love, approval, or respect, they experience it in a catastrophically painful way. It can just absolutely ruin that whole day and the next day. It's extremely painful. It's not that people with ADHD are wimps or far from it. I mean, people with ADHD, it requires an act of courage to walk out the door into the world because practically anybody can wound you. And for, again, 40% of people, that's the piece of ADHD that is most impairing. There's one study out of Tulsa, Oklahoma, where they looked at people being court-mandated for anger management therapy. These were repeat domestic violence, repeat road rage, that sort of thing. And what they found was that 50% exactly had previously unrecognized and untreated ADHD. And it was a combination of the rejection sensitivity where if it's externalized, it's usually externalized in a rage at the person or situation that wounded them so much, or it's the fact that most people with ADHD don't see their mood shifts coming. They find out what they're going to think, say, do, and feel in exactly the same way everybody else does. It's already out there. They have no warning that it's coming. And what medication does is it gives them the same 2 seconds that everybody else has to see it coming up, label it, I'm getting angry, and if I get angry, this will happen, I don't want that to happen, and they're able to redirect it some other way. When they're blindsided by it, it's already out there, the damage is done. So these are people who really find that they need to be on medication 24 hours a day because, again, you can't have an outburst like that and then take the medication already too late.
Oh, interesting. So the rejection sensitivity that you've spoken out about and really has resonated with so many people who've heard you say that is, as you describe it then, one side of the rage and irritability, which comes from feeling unappreciated, rejected, whatever. Is that a simple-minded way to say it? Okay.
No, that's exactly it.
That's interesting, really interesting. Pat Ann, who's on the webinar, would like to know more about a quote that I think she pasted in. I think it came from maybe one of your earlier presentations, which says something like, clinical experience has found that up to half the people with rejection sensitivity can get relief from some of the alpha agonists medications. Can you talk a little bit more about medication for the rejection sensitivity side of ADHD?
As a caveat, this is a clinical observation. There is zero research on this.
Okay.
What I found and what several of my colleagues have found is that some people can get a response to what are called alpha agonist medications. There are 2 in the United States. Clonidine is the immediate release, with Capvay being the extended release, and glomphosine with Intuniv being the extended release. And what they find is that they describe it like putting on emotional armor. They still see the same things happening that last week would have wounded them, but now it bounces off without hurting them. And how tremendously freeing that is. It allows them to try things. A lot of people with ADHD won't even start something unless they're absolutely assured of quick and easy success, because failing or disappointing other people is so excruciatingly painful, it's better not to have even tried than to try and fall short.
Right.
Unfortunately, the majority of people don't get much benefit in terms of the rejection sensitivity. These medications still are the medications of choice for the hyperarousal component of ADHD. But now we're also finding that it's very helpful with the rejection sensitivity for about 40%. Again, that's a scientific wild ass guess, but about 40%.
Okay. Rowena has been diagnosed in her 60s with very severe ADHD, and she says that one of the main symptoms for her has been extreme impatience. It's almost painful to have to make small talk. She can't bear to watch TV with for any length of time. Are these symptoms are those typical of ADHD, or would those make sense with ADHD? That kind of impatience, extreme impatience.
Absolutely. In fact, those are diagnostic criteria under the DSM-5. Extreme impatience, can't wait your turn, can't wait in line at the grocery store, can't wait for other people to finish what they have to say. Again, because they are moving so fast. This is the little kid who is propelled forward as if by a motor.
Right.
They just can't stop, and anybody that gets in their way is frustrating. So impatience is a very, very common impairment of ADHD. It gets a little bit better with the stimulant medications. It gets a lot better if you respond to one of the alpha agonists.
Okay, that's really interesting. Okay, Marta wants to know, what's the bright side of having ADHD? I know there is one.
No, there are a bunch. I really like people with ADHD because they're so much fun. Their whole nervous system is built on, let's go do something new, fun, interesting. They're dynamic people. They are world-class problem solvers. And it's what's called saltatory. They leap. They can wade into a problem that has stumped everybody else and go zing right to the answer. And even they don't know how they got there, but they know from experience when they're right and when they're not. So if you think about what we pay the big bucks for out in the world of work, it's for the person who figures out what to do, not the grunt that goes and does it. There's a very good book called Clever, and it's actually written by two guys from England, so they have no idea they're writing about ADHD. But it's Harvard Business School Press. And what they say is what Western corporations make their money on right now is this small group of extremely clever people who come up with the out-of-the-box thinking, the next Facebook, the next Google, the next Volkswagen Beetle, the next iPad, because they are out-of-the-box problem solvers. And they go on to describe what these clevers look like, and it's the best description of an adult with ADHD I've ever read.
So interesting.
And
I always wondered if it's because people with ADHD are such synthetic thinkers. They see, it's my sense, and tell me if you think this is right, that they see all the different angles of something and put it all together in a way that neurotypical people might have a harder time doing.
Yeah. They start out of the box. It's not they step out of the box. They're already there. And on top of that, people with ADHD are wicked smart. Again, because the early diagnosis is usually made as part of a learning disability evaluation, that's perpetuated the silly notion that people with ADHD are somehow brain damaged or defective. In point of fact, the average IQ of an adult with ADHD is 122, enough IQ to go to a competitive university and get a doctoral degree.
Wow.
So people with ADHD are very bright, very clever about how they use that intelligence. They are very affable, likable people. And they also have what Paul Winder referred to as relentless determination. That once they hook into a problem, they don't let up until they've mastered it. So if you could imagine just going to the shelf and pulling off qualities that would assure your success or your child's success in life, the four I'd want is I'd want to be real bright, I want to be creative about how I use that intelligence, I want to be well-liked and have people happy I walked into the room rather than otherwise, and I'd want to be hardworking and diligent. And the nice thing is that all of those things stay when you treat the ADHD.
They do. So treating ADHD doesn't give us the risk of losing those great problem-solving dynamic personalities.
Not at all. Not in the slightest.
Well, that's a great description of ADHDers. Everybody rejoice. Thank you so much. I think Carrie just posted, Dr. Dodson is describing my husband. That's great. I think we're going to have to stop. As always, this has been incredibly helpful. Thanks so much, Dr. Dodson. Really terrific session, as always. Appreciate it.
For more Attitude Podcast and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.